one of the keys in all of medicine, no matter what you do, no matter your role, is knowing what you can handle and what you should refer out.
Yeah, I lay it out for guys. I say, testosterone, like we talked about, is going to 100% affect your fertility. So let's talk about that. So here's the safest thing you can do is don't do anything. That's number one.
Good point.
It's easy for me to be comfortable with the decision because it's not my child, it's not my family planning on the line. But you need to be comfortable, and your spouse or your partner needs to be comfortable as well.
Hey guys, welcome back to another episode of the Vitality Code podcast, powered by Vitality Telehealth for all your telehealth needs. Yeah, so man, last time we talked about, is fertility even a concern on TRT? Why is it a concern? Should we discuss? Should we not? How should we? And we kind of talked about we kind of nerded out on the hypothalamic pituitary gonadal axis. Just at least from a patient perspective.
I like the way you say that. It's nice.
You like that?
I did. It was very scientific, and you just rolled it out. It was good.
Yeah, kind of the way the syllables are. Just I didn't get hung up like I usually do when I try to say it.
No, I butchered every time. Like your hypogonadal, hypothalamic pituitary. Yeah.
Is there a niner in there somewhere?
There's a niner.
Yeah. What do you think Joe Biden's hypothalamic pituitary gonadal axis is going to Everything is going to be Poor Joe, man. That's like
I bet Trump's
at this point
testosterone's still crushing it.
Absolutely. But at this point, I think we should all be ashamed as Americans because I think we're all complicit in elder abuse. I mean, That's a
good point.
This is bad. This is
the way
so
it is,
bad.
though. We're rolling with it. You're here for the party.
So roll it right into the end of the century, man. End of the decade or whatever. Come on, baby.
That movie where there's a asteroid coming and
yes,
God, they're scientists and they discover a comet and they try to raise everyone. It's coming towards Earth. It's huge. It's the size of Texas or whatever. It's going to wipe out. It's going to be a planet killer, and nobody believes them. And then they go through this whole thing of like the president, and then they can't get this plan together because of politics, and people are just idiots. And then their version of Apple computers, I think that's who they're trying to intimidate. Or imitate that person says he has a plan. They're going to privatize it, and they did this whole thing and.
Jeez.
It's funny. It's a comedy, though. And so the world goes down in flames, and they're all just at their very end. They all just like, all right, let's just sit here while the world goes down in flames. It's a classic. What the hell is that movie? I'm going to Google it. We don't have a Jamie. Don't Look Up.
Yeah,
Is
producer Grady.
He just hit it to me right off the top of his head.
Come on, Grady-licious. G-Man.
Yeah, it's a 2021 film called "Don't Look Up." You got to watch that. It's awesome.
No, I haven't seen that one.
It only got 55% on Rotten Tomatoes. All right,
you got to be pretty artsy-fartsy to get high on Rotten Tomatoes.
Do you? Is it art? It leans art.
I don't know. Who knows? Yeah.
I just watched Inside Out 2 with the kids.
Dude, not bad, right?
I was like, this is going to be a train wreck. It's going to be a woke debacle of ridiculousness that I'm going to hate.
It wasn't too bad.
And it was great. I thought they did an awesome job. They
kind of hit right down the middle of the road. They didn't step really. They kind of just stuck to it was narrow in focus.
Like a movie,
it was good.
not a lesson in societal change that I have to adopt or some ridiculous thing that my kids have to adopt.
Crazy,
I was like, they're going to talk about anxiety. It's going to be awful. But I thought they did great. I thought it was good. It was funny.
It was very good. It kind of captured what it was like to be an awkward teenager going. Mm-hmm. Yeah, I thought that was a fantastic, and it deserves all the success it's getting. I took the kids to it. It was good. So
I digress.
Speaking of embarrassment, don't be embarrassed, guys. If you want to talk about your fertility,
nice segue.
Wasn't that? It was good,
was
man.
Well played.
You put that up there. You kind of just pitched me a little softball.
Yeah,
and I said,
was
all right. I'll knock that one out of the park, baby. Yeah, so the last episode we talked about, does it matter? The hypothalamic pituitary gonadal axis, HPG for short, and how to think about it, a framework, and it does matter. But if you get down that road, you may get to, or even guys might talk about, or partners and couples may, who knows what's going to come in your clinic. And you have to, and let me just front run all this by saying we are not fertility specialists, nor are we urologists. And one of the keys in all of medicine, no matter what you do, no matter your role, is knowing what you can handle and what you should refer out, right? So
Stay in your lane.
Stay in your lane, absolutely. Now, that being said, especially, and it's very much highlighted, I think, very nicely in this particular niche field, if you will, of medicine, or this niche space of medicine, is that it's very difficult for people to talk about hormones and fertility, number one. So if they feel comfort with you, that's something that, again, that may be, and you may take that comfort and refer them. They may trust you, and then use that to refer them. Or one of those people may not be accessible, right? A urologist may kind of be sticking to taking out prostates and putting penile implants in. They don't want to deal with fertility in your area.
That's a good point.
A fertility specialist may be very difficult to find. So whilst knowing when to refer out is important, it also is when can you safely at least get the ball rolling. Maybe do some beginning tests and start to treat it. Yeah,
I think of my role as a referring physician as like a nurse assistant. Like we worked together when I was just a nurse, and I think of it as I'm the assistant to this referring doc because that's advantageous to the patient. So I want to know about what testing is going to be needed for this OBGYN. I want to know what testing is going to be needed for this cardiologist. I want to know what MRI on the chiropractic side that the neurosurgeon may want. And while I may not be 100% knowledgeable and I may not get every single nuance right, what I don't want you to do is go to that specialist and they're like, well, okay, let's do this test and come back in 6 weeks, when I could have ordered that test because I have some primary care side. So I like to do as much testing preemptively, be as knowledgeable as I possibly can. While I'm not using that information to supplant the referral, it is to assist in that referral best I can at the patient's benefit. That's how I kind of view it.
Right, and assist in the discussions and help them understand. Because again, you're likely going to be a trusted provider, and et cetera. So what would be good to discuss is maybe testing for fertility. And I don't know, have you done any testing for fertility in your clinic, or if you have, or do you consider that what you have done to be testing for fertility? And give us examples if you can.
Sure. Yeah, I see a lot of young males of childbearing age, if you want to steal that term from women, but
that's an important thing though, actually, because that's a really good one actually, because it's important to remember that men can be fertile into their elder years, but that which normally would have children, I guess. Yeah, but that's
I discuss it with all my males. I say, you don't know what you're gonna. Some guys are like, I don't want children, or I have one, and I'm like, dude, you might be. I don't want to talk bad, but jinx you, but you might be 50 and have a divorce, and the new wife hasn't had children, or you may change your mind. You may. Who knows what'll happen, right? In 20 years of your life, or surprise. I lay it out for guys. I say, testosterone, like we talked about, is going to 100% affect your fertility. So let's talk about that. And the guy may say, "Oh, I've had a vasectomy. I got 3 kids. I'm done." Okay, that makes the conversation a little shorter. But let's say, let's say all the options on the table. I say, all right, so here's the safest thing you can do. Is don't do anything. That's number one. Like, let's say you have a strong family history, you were concerned, maybe you tried before, maybe your father had a hard time conceiving.
By don't do anything, what do you mean by don't do anything?
Sorry, don't take testosterone. If you have any concern at all.
Yeah, good point.
That's the first step. And then I follow that up. I say, you may even have a step above that if there's significant concern, meaning you've tried and you are classically infertile, 12 months, where you may actually just take a Clomid or an HCG. So this is how I started. I say the option 1, don't take testosterone at all. If there's any concern, you need to be comfortable with your decision. It's easy for me to be comfortable with the decision because it's not my child, it's not my family planning on the line. But you need to be comfortable, and your spouse or your partner needs to be comfortable as well. Secondarily,
now,
I say,
what if they say, "Well, I've got low T. Can I even get somebody pregnant?
Yeah, that's when I say that's when we go up to the top and we say maybe there is a play where we just do Clomid or just do HCG and we do some testing. So what I do is I go through this little framework and I say, don't do anything. Then I say you can run testosterone and one of the preventatives, and we'll talk about this more in depth, and then run testosterone, then ancillaries, etc. So on that testing side, if we decide that maybe there is some concern, maybe there is some infertility. I had a young guy, I don't think he was this week, maybe last week. He had tried some anabolic steroids, had a really negative reaction to them, and was a little bit concerned and wanted to get off.
What was the reaction?
He became impotent. He could no longer get an erection. And
whilst on them.
Whilst off them. He ran 2 cycles, so he got some I guess black market. I don't like to say that term because it sounds like he's doing some super shady, but he got some non-prescribed anabolic steroids, did the cycle, liked it, everything was fine, he said, came off it cold turkey, and then couldn't get an erection. And then after that, the buddy who gave him the original supply said, well, you didn't come off it correctly. Let's go back on. You got to do a bigger dose now because this problem is there. So let's correct it by ramping the dose up. And then let me give you, I want to say.
And his buddy probably didn't have any way to draw his labs and guide him from a
Oh, God, no. This is like, we're just
bro
running
science.
like
Pure bro science.
Pure bro science and bad bro science at that. I've heard some decent bro science every once in a while. Illogical bro science. It didn't even follow logical. And then he gave him, I forgot what he gave him for a PCT, but I think it was an aromatase inhibitor that he was, tamoxifen, I believe, was what he gave the guy. He said, you got to run this afterwards. And I believe the second cycle was a different one. I believe it was Tren, and he didn't like it, didn't go good. He had some mood changes. He was like, I don't know what. Now it started to get in his head, like, I don't know what I'm doing, right? He started to realize that maybe some of the error of his way. And then came to me, and so he was like, have I screwed myself up? And so that's the point at which I met him. He said, I have some problems. I need erection help. Fixing this. I don't know how to come out of this hole that I've dug, and I don't know what I've done to my testosterone. And, oh, by the way, I've never, and I think he was 28, I've never in my 28 years have used a condom, and I've never gotten a woman pregnant, so I don't even know if I'm fertile. He's lots of questions, and I said, all right, we got lots of things going on here. Let's push everything away, and let's start from square one. Let's deal with the issues at hand. And so we actually did some sperm testing on this guy prior to starting testosterone or even considering.
So if we're couching this, so the discussion at hand is testing for fertility in the patient who comes into a TRT clinic. Okay. And so in this guy, that involved, did you get labs? I'm sorry, you probably just said it, but did you get labs prior?
Yeah. So what we
decided,
decided
or did you get right
was,
to the sperm, or what?
Nope. I said, here's what we're going to do. I don't even know what your testosterone levels are. They may be completely fine. You may not have done any damage yet. Not having unprotected sex to whatever degree you were up until this point, not having a child does not mean you're infertile, but you have a level of concern. Let's address this. So we did a full set of labs on him: FSH, LH, testosterone, estrogen. And I encouraged him to just go ahead and order a sperm test. Let's just find out. We had to do a little workshopping. Not every lab, Quest and LabCorp, not every location, I should say, does sperm testing, and there's some protocols. And so
really?
We there's only one in Tallahassee that does it. I've had some across the state.
Only one center at all, not
correct.
Lab. Okay.
It is, in Tallahassee it's LabCorp, and only one of them. Down in Middle Florida, I was consulting on a patient, and the only one was a Quest, and it was like an hour away. So with that tiny sample size there of 2 examples, it's not like running down to the typical LabCorp and getting that test done. You need to find out. There's 2 tests you can run. You can run a post-vasectomy sperm test. They just give you total count and just like a raw number, and then no morphology. The fertility one, and that one was $100 if I remember correctly. The post-vasectomy test, and the follow-up, or the more in-depth one, gave you color, appearance, the morphology, all that kind of stuff. And that one was $250. That's cash to LabCorp. That generally how I run my clinic on specialized things like that. Let's just find you the cheapest route. And there are some fertility clinics that will do the testing in office, and I use those down south one time. But those can be sometimes hard to get referrals to, and you have to jump through a bunch of hoops. So on this patient, we went ahead and did a sperm test. I don't think I've done, that was my first one probably before starting anything in the years that I've been doing this. And I actually had a second guy followed up right within a day or two, so he's yet to get his sperm test done. But and so we ran that sperm test prior to starting any testosterone.
And the second guy was for what reason?
The second guy he had a really subpar FSH, LH, a younger guy. Him and his wife, I believe wife, maybe fiance, were in immediate, with less than a year, deciding likely to start, but he had really low testosterone and a really subpar FSH, LH. Normal, quote-unquote, reference range, but I was like, man, we're going to be making decisions about your fertility. We're going to be making decisions soon about your ability to have children, and you're likely going to be on testosterone making that decision because you're in the 200s right now, and he was in his 20s too, I forget, or maybe right at 30. And so we decided, hey, this is going to be a long journey for you. You might be on testosterone for 30 years. Let's go ahead and just get a good baseline on you, because I have also learned that spouses generally have a different comfort level than the guy taking testosterone, or whether or not it's affecting their fertility. And I would say that's a huge thing that influences. The woman wants to know that you're not diminishing their chance. And I said, if you started testosterone, we don't even know how fertile you were before. Let's get some sperm counts. We'll have some hard set data. Maybe we'll never use it. Maybe it's more than is necessary, but at least we can get some hard set data on you, and then we can use that as a launching point. And if we ever test it down the future, you have that evidence that this is or is not significantly affecting your testosterone. Or sorry, your sperm count.
Yeah, I think you made some really good points there. And if I would just talk about them, I would go. Let's just go backwards. Like you said, it was an interesting thing too, the social dynamics or psychological dynamics or relationship dynamics in couples. And of course, who would, I wouldn't blame. Now, first of all, it takes two to tango, as they say, right? So there's two sides of the equation. And if we're going to be testing fertility, perhaps we should be testing both partners. But, well, and that's interesting too. So, I think it's globally the infertility rate's like, what is it, 8 to 12 or 18 to 15%? In the US, it's about, is about 15%. But so
15% of couples in the U.S. are infertile.
Yeah. And so we should be testing both. But yeah, I couldn't blame a woman for doing that, for wanting to know. I mean, it's a big deal, and she's the one that has to carry the baby, and there's a big implications for starting a family and so on and so forth. And what I like about what you did with that is you went right to the proof is in the pudding, or is an expression, tissue is the issue. To me, in my mind, just let's go down to the very end of the pathway at what is a sperm and an egg, right? So let's look exactly how much sperm you have. Well, can't we just look at all? Yeah, you can look at all those other levels, but it's misleading, and therein lies the nuance. And the nuance is somewhat highlighted by what you discussed. And it sounded to me like this guy had low range LH and FSH, and he had a low testosterone or hypogonadal testosterone. Did he have a low normal testosterone and symptomatic, or was he on below the threshold?
Remember? I'm gonna have to plead ignorance. I want to say it was low, like below the.
Yeah, and I recently saw a guy in the clinic who, interestingly, had a child, and then came to me, symptomatic, but not horribly symptomatic. Was wanting to get into shape, had gained a lot of weight, energy and libido were issues. A friend had discussed and told him maybe you should take your testosterone. Came back, he was 30 or 33, somewhere in that range. Testosterone was 171.
Oh,
I said, good God! So
naturally, not even anything, not taking anything.
Had never
to suppress
taken
it.
Claimed to have never taken it, and
my lowest
story
is 160.
That's your oh, hey, I got you beat. 71.
I think he said 171.
71. Huh?
I think he said 171.
This particular guy was 171. My lowest ever was 71. And it was no. And well, hold on. And this was on a guy who was on TRT in a different clinic. And and he said it was the craziest scheme.
Cream?
No, it was, dude. I'm telling you,
Once
it was
a month injection.
Yes. It was like this weird. And I said, wow, they're giving you just enough to suppress your endogenous levels, and nowhere near enough to provide any therapy. I mean, they hit the sweet spot, man. They hit the sweet spot between those two. I mean, man, they nailed it on the head. Not what you want to nail on the head. Yeah, I was shocked. I was shocked the guy didn't just like come do an army crawl into the office. I mean, just 71. I mean, it's unreal. Anyways, and it's interesting. This guy.